Welcome to SVG-TV News for Monday, August 7th, 2017. I am Rochelle Batiste with the details. The recent death of community and social activist Oscar Allen was not caused by a delay in a medical procedure at the Milton Cato Memorial Hospital. This was made clear today by Prime Minister Dr. Ralph Gonsalves at a media conference where he spoke on various issues of concern to the nation. Addressing what he called cruel suggestions, PM Gonsalves said, according to information received from the relevant authorities, Allen's death was not caused by improper medical care at the Milton Cato Memorial Hospital, noting that such a claim does a disservice to the medical professionals at the hospital and is an act of cruelty to Allen's family.
I read what they write and I listen to what they say. I have spoken to the authorities on this matter, and the authorities have advised me that the delay was not the occasion or the reason for our dear brother's demise. I can't talk about his condition. I'm not a professional, and also it is not proper for anybody to be talking about that without the permission of the family.
Addressing the issue of having more anesthesiologists at the hospital, the Prime Minister said that the current 2 of the 3 are on medical leave and the government has been engaged in a multifaceted approach in securing the services of such a professional on a short-term basis.
When I was informed about it, because they're doing their work, internal work, and not every senior public servants would say, well, okay, I can solve this without the intervention of the Prime Minister. Or indeed, inform the Minister, but saying, listen, we think we are handling this because we have the contact to get somebody. But when they feel that they need your input, you call, and I got in touch immediately with Cuba. And the request is there, just over a week now, week plus, to try and get someone. Luke Brung himself has contacted the Taiwanese through the relation we have with the Central China Hospital in Zhenghua. Other short-term efforts are being tried.
PM Gonsalves added that there are persons who have been engaged in only highlighting the shortcomings of the local health sector, but not shedding light on the positives.
No discussion that we have down there in a partnership with the World Pediatric Project and the Mustique Charitable Trust, the Center for Pediatric Care, particularly critical pediatric care in the whole of the Eastern Caribbean. Patients come up from Suriname, Guyana, some even come from Barbados, they come from the rest of the OECS countries here. Since 2002, they have provided for St. Vincent and Grenadines medical attention for Vincentians valued of over 100 million Eastern Caribbean dollars. It's there, you can see it. We see the over $5 million refurbishment of the hospital, additional theater, refurbishment of the male surgical, and all of that.
And Minister of Health Luke Brown on the radio today acknowledged that things are not perfect in the operations at the country's main health facility, the Milton Cato Memorial Hospital. Speaking on Boom FM, Senator Brown said there are certain cases where better can be done in the offering of services at the main health facility. Shedding light on the issue of some delays in the surgical operations at the hospital, Senator Brown reiterated that his ministry's aim is to always put the patient first.
Dr. Mandel, who's a consultant there, he had to be off on leave. We have 3 doctors in this specialty, and there's another doctor who had to go on maternity leave because of complications with the pregnancy, and that is an extended maternity leave. So it meant that we were left essentially with 1 doctor to bear the strain of both emergency cases and cases which are elective. That was a heavy burden to bear. It meant that there were some delays, and in the course of these delays, in all the correspondence on the issue, because something of this nature would come to the attention of the minister. In all the correspondence, I've said, look, we have to minimize the restrictions and the inconvenience to the greatest extent possible. Waiting on word out of Cuba in relation to the possibility of us getting an additional anesthesiologist from there. More than that, we have someone who was within our system before, who is working in Guyana at the moment, and we're in negotiations with them. I took the initiative as well of approaching the ambassador for the Republic of China and Taiwan and asked if the Chunghwa Christian Hospital, with which we have good and solid relations over the years, might be able to provide us with an anesthesiologist for, maybe the period of 1 year.
Commenting on a letter which was written by the late Oscar Allen, who issued his concern on the delay of operations at the Milton Cato Memorial Hospital, which Allen himself had been subject to. The health minister also dismissed claims that the community activist's death was as a result of negligence on the part of the hospital.
We have to look at both sides. We have to look, as you said, in your case, individuals are going there for treatment. Individuals have confidence in the system. This isn't to say that things are perfect and we don't have shortcomings here and there, but individuals also express confidence. Oscar himself, in the very letter that you read there, expressed trust in the system and in the Milton Cato Memorial Hospital.
But what happened to him?
If there is in this case, and I do not anticipate that there will be any negligence that could be validated, then obviously somebody has to be held responsible for that. But there is a process that could be followed in relation to that, and a process that would be followed in relation to any other case. And at the end of the day, if somebody messes up in relation to a patient and negligence is found, then the individual who is responsible for that action will be liable and would be responsible. I mean, this is not a ministry of cover-up. I mean, at the end of the day, we want what is best for the patient.
Brown further added that as the Minister of Health, Wellness and the Environment, he is responsible and completely focused on the general direction and control of his ministry.
No matter how much we advance, and advance we will, and advance we must. There are certain things that are happening right now which speak to an improvement of the system and our ability to deliver care. Where there are these complaints, as the Minister of Health, I don't want you to feel as if it's not something that you could bring to my attention, because it's only by becoming aware of certain difficulties and challenges that we could be able to respond to those difficulties and challenges more fully. Negligence or any other form of incompetence in the medical services or in any other aspect to do with health, I think that we should move against that. And one of the reasons and one of the ways in which we're expressing our view that we should move against that is the fact that we're looking to have published very soon a patient's charter, and this is going to basically set out that our interest is in the patients first.
Highlighting that the subsidy which is provided to Health Solutions Inc. for dialysis treatment to kidney patients here is half of his ministry's medical assistance budget. The health minister outlined that his government continues to seek ways to improve dialysis treatment and care for all here in SVG.
Dialysis, for instance, is something that we're trying to get right with the coming on stream of the modern medical complex in Georgetown. And even while that is coming on stream, I should tell you that we're hoping to be able to take some measures in relation to the Milton K2 Memorial Hospital, so that at least in case of emergencies we could provide hemodialysis services there. And that, I think, is a critical area. The government currently has a subsidy of about $88,000 a year for dialysis, hemodialysis, and that subsidy is more or less divided among all the patients who require that kind of service. We do not provide hemodialysis in the public system right now. It's provided by Health Solutions, and we have arrangements with Health Solutions that allows individuals to be able to access the treatment and care there. And we want to do more so that the results and the outcomes for patients could be a lot better than they currently are right now.
Meantime, former opposition leader Arnim Eustace said he is appalled over a review of the state's health sector, which was made by a renowned regional public servant. Eustace on the radio today read part of the review, which labeled SVG as one of the worst defaulters of payments to the OECS Pharmaceutical Procurement Service. Eustace said that he believes the review was made out of pure frustration over what he claims is the government's delinquency on payments.
You know, when a regional public servant speaks this frankly about a service that the region is offering, when he speaks so frankly, I can tell you that he is at the point of frustration.
True.
And I want you to listen carefully to what he said. And I quote him now. St. Vincent and the Grenadines is reported to be one of the worst defaulters of payments to the OECS Pharmaceutical Procurement Service. That is the part of the OECS which buys the drugs for the various countries, for the hospitals and so forth. He made this statement while in Kingston a couple of days ago. At a seminar. The seminar was hosted by the Pharmacy and Therapeutic Committee and the Ministry of Health, Wellness and Environment in collaboration with PAHO, right here in St. Vincent last week. He went on to say, we have a big problem in St. Vincent and the Grenadines. Well, listen carefully. We have a big problem in St. Vincent and the Grenadines. Getting money from the Treasury to finance medicines and healthcare in this country.
The opposition MP said that the article further suggested a health insurance policy for citizens, which he too believes will be able to curtail the nation's high health care expenditure.
To meet our demands with some degree of automaticity, we need some form of health insurance where the working population pays for the entire population, just like the NIS. Notice, we need some form of health insurance. That's what the NDP established in 2001 and was about to start operating. We just cannot do it. And therefore, the demands, more and more patients are going to be in primary health care in order to get prescriptions filled, as opposed to going to the private sector pharmacy. Mr. Barnes explained that St. Vincent and the Grenadines, in terms of defaulting on paying for supplies, is one of the worst defaulters, St. Vincent and the Grenadines. He noted that the gap is getting wider and wider between the time we are supposed to pay and when we do pay here in St. Vincent and the Grenadines.
General Secretary of the National Workers' Movement, Noel Jackson, is stressing the need for employers and employees here to prepare themselves for the passing of the Occupational Health and Safety legislation. Jackson comments came on the Views and Issues program on NBC Radio on Sunday. The trade unionist said that while the bill is still in the drafting stage and before a select committee of Parliament, he is concerned that some employers might not be ready for the legislation.
Discussions are still taking place, I believe, to ensure that when the legislation comes on stream, that the employers are ready. Because to be truthful, Avi, there are some employers that I don't think are ready for this piece of legislation here. And there needs to be some preparation. There is going to be need for professional help. For example, Mrs. Charles here, she is the health safety and environment coordinator at East Caribbean Group of Companies. And most companies are going to have to go in this direction in order to as she said, become compliant and to actually fulfill the obligation as it relates to the law. It is not going to be an ad hoc situation as existed in the past. You are going to have persons specifically coordinating or basically overseeing health and safety at the workplace.
Noting that the absence of such a legislation continues to present numerous challenges in the working environment, Jackson said it is time that the legislation takes effect, noting that it will be in the best interest of all workers here in SVG.
What's been happening is that we've been dealing for a long time with the old 1952 Factories Act, which basically was totally obsolete. And you had to use your own initiatives to introduce measures and systems to protect the workers. For that reason, we in the National Workers Movement would have placed in every one of our agreement a health and safety clause that established a health and safety committee comprising persons from the union and persons from the company. That has helped to a large extent to introduce some ideas and measures that would have sufficiently held sway as it relates to the health and safety of the workers in the workplace.
Acknowledging that it will be a costly venture in getting all employers and employees on board to adhere to the regulations, Jackson said it is something that must be done, hence early preparation is a must.
So it's going to cost some employers some money. The smaller companies, we have been expressing some concern about the smaller companies. And I believe in the mix, in the process of discussing the introduction of the legislation, some provision would have to be made to ensure that the smaller companies are able to survive and to introduce the legislation without it adversely affecting their cash flow and so on and so forth, because they are going to have to comply and they're going to have to spend money to buy safety gears and all the necessary things to protect the workers.
In other news, Vincentians from today is expected to see a visible reduction in the cost of liquefied petroleum gas or LPG. The announcement was made at a media conference earlier today by Prime Minister Dr. Ralph Gonsalves. PM Gonsalves stated that previously LPG was priced based on the cost of kerosene, a practice which was impractical, adding that the government introduced a scientific method of pricing which is more fair to all involved.
LPG was benchmarked against the price 90% of kerosene. But there is a base price, the Mont Belvieu price, that's a place outside of Texas, which is used for LPG, and we use that as the base price, and we do all the build-outs on the base price with all the margins required to arrive at what the price should be in St. Vincent and the Grenadines. So there is a scientific manner sensible, economic way of addressing this question. And over the long haul, it is fair to everybody, the consumer and the importer of this commodity, LPG.
The Prime Minister highlighted some of the changes which should have already gone into effect on the mainland in areas 1, 2, and 3.
Now we see changes in the prices. So in Area 1, you know, there are 4 areas. Area 1 being the area where you would have, I think, the most consumers in any particular area, because in the Kingston area and surrounding, the price which existed before today for the 20 pound was $36.60. It's now from today $34.52. For the 25 pound, from $44.50, it's gone to $41.91. And the 100 pound in Area 1 from $178.10 to $167.62. And similarly, we see decreases in Area 2.
PM Gonzalez added that the Grenadines was not left out and highlighted the decrease persons living there are expected to benefit from.
Remember, there was a lot of comment about Area 4, which is down in the Grenadines. The 20 pound was $41.60. It's now $39.52. 25 pound, $49.50. It's now $46.91. And 100 pound, which was $199.10, is now $188.62. I don't have to go through areas 2 and 3 because you can always get a copy of the statutory rule and order, which has been published today. In fact, I think they published it in the Extraordinary Gazette on the 4th, but it came out today.
Still on the matter of LPG, PM Gonzalez stated that the government had decided against subsidizing LPG and instead focused on putting resources into other programs designed to assist the poor and disadvantaged.
It's done accordingly. By the way, I urge persons not to do comparisons across the currency union with LPG prices, because some countries subsidize LPG. This government has taken the decision not to subsidize LPG, because if we subsidize LPG, we are subsidizing the hotels, the restaurants, the wealthy. Of course, we're also subsidizing the poor, but I prefer to take the money and give it in support to the poor through public assistance and the like, rather than subsidizing persons who are quote-unquote able to manage.
In other news, the Rural Transformation Unit, in collaboration with the Basic Needs Trust Fund, the BNTF program, will host a closing ceremony for the Enhanced Capacity for Improved Food Security and Livelihoods Rabbit Rearing Project in North Leeward this Tuesday, August 8, at the Chumuka Secondary School, commencing at 10 a.m. Along with a certificate of completion, the Rural Transformation Unit will be distributing rabbit and a rabbit rearing kit, which will consist of medicine, feeds, and manual to 30 persons residing in the Chumuka and Rose Hall communities. The project is funded under the BNTF program to the tune of 28,000 United States dollars. The Rural Transformation Unit says it will continue to monitor the project and encourage the participants to produce rabbits commercially as a cooperative. Minister of Agriculture, Rural Transformation, Forestry and Fisheries, Sabota Caesar, will deliver remarks at Tuesday's ceremony.